gonna tell.
Pharmacogenomics and personalized medicine. Hey everyone, welcome back to our channel. Today, we're diving into the fascinating world of pharmacogenomics and personalized medicine. These terms might sound complex, but don't worry, we'll break them down together in a way that's easy to understand. So, let's get started. First up, we have pharmacogenomics. This is the study of how our genes affect how we respond to medications. Everyone's genetic makeup is unique, and this uniqueness can influence how well a drug works for us or whether we experience side effects. By understanding these genetic variations, healthcare providers can tailor medications to fit individual patients better. Let's start with some key terms. First up is pharmacogenetics. This is actually a subset of pharmacogenomics. While pharmacogenomics looks at various genetic variations, pharmacogenetics focuses specifically on how single nucleotide polymorphisms, or SNPs, affect drug response. Think of SNPs as tiny variations in our DNA that can influence how our bodies process medications. So, pharmacogenetics is like a piece of the larger puzzle that is pharmacogenomics. Together, they help us understand why some people respond well to a drug while others don't. Personalized medicine is all about tailoring medical treatment to the individual characteristics of each patient. Imagine if your doctor could customize your treatment plan based on your unique genetic makeup. Sounds cool, right? This approach relies on our growing understanding of how our genes influence our health and how we respond to different medications. Now, let's talk about two key terms, pharmacogenetics and pharmacogenomics. Pharmacogenetics is the study of how our genes affect our response to drugs. It focuses on specific gene variations that can influence how well a medication works for you or if you might experience side effects. On the other hand, pharmacogenomics takes a broader approach. It looks at all of a person's genes and their interactions to understand how they influence drug response. Think of it as the big picture of genetics and medication. Now, let's talk about personalized medicine. This approach takes pharmacogenomics a step further. It's all about customizing healthcare, with medical decisions, treatments, practices, and products being tailored to the individual patient. Imagine getting a treatment plan designed just for you, based on your genetic profile. Sounds amazing, right? So, what's the genetic basis of personalized medicine? It revolves around understanding specific genetic markers, like single nucleotide polymorphisms, or SNPs for short. These are tiny variations in our DNA that can impact how we metabolize drugs. For instance, some people might metabolize a medication too quickly, making it less effective, while others might do so too slowly, leading to potential toxicity. Now, let's explore the benefits of personalized medicine. One of the biggest advantages is that it can enhance drug efficacy. By knowing how a patient's genetics affect their response to a medication, doctors can prescribe the right drug at the right dose. This can lead to better health outcomes, fewer side effects, and a reduced risk of adverse drug reactions. Plus, it can save time and money by avoiding trial and error prescribing. But it's not all sunshine and rainbows. There are also limitations to consider. For one, the field of pharmacogenomics is still evolving. Not all genetic variations are well understood, and sometimes, the cost of genetic testing can be a barrier for patients. Additionally, there's the challenge of integrating this information into everyday clinical practice. Not all healthcare providers have access to the latest genetic data or the training to interpret it effectively. To sum it all up, pharmacogenomics and personalized medicine are revolutionizing how we approach healthcare. By understanding genetic variations, we can tailor treatments to individual needs, maximizing efficacy and minimizing risks. However, we must also navigate the limitations and challenges that come with this innovative approach. Now let's look at some examples. Take the cancer drug tamoxifen, for instance. Studies show that patients with estrogen receptor-positive tumors are more likely to benefit from this treatment. That's pharmacogenomics in action, helping to identify who will respond best to a specific therapy. Another example is warfarin, a blood thinner. Genetic variations in the CYP2C9 and GORK1 genes can affect how well patients metabolize this drug. Knowing this can help doctors prescribe the right dose, reducing the risk of bleeding complications. But it's not all smooth sailing. There are challenges in implementing pharmacogenomics in everyday practice. For one, not all healthcare providers have access to genetic testing, and there's still a lot to learn about the complexities of our genomes. Another example is warfarin, a blood thinner. Genetic variations in the CYP2C9 gene can affect how quickly a patient metabolizes the drug, meaning some might need a lower dose to avoid bleeding complications. Let's look at some other real-world examples. Take tamoxifen, for instance. This medication is used for estrogen receptor-positive breast cancer. Patients whose tumors test positive for this receptor are more likely to benefit from tamoxifen therapy. The future of personalized medicine is bright. With initiatives like the All of Us research program, which aims to gather health data from 1 million people, we're on the path to a new era of medicine. This research will help us understand how to prevent diseases, tailor treatments, and even discover new uses for existing medications. Now, what's important to remember is that not all patients respond the same way to these drugs. This is where pharmacogenetics comes into play. Pharmacogenetics is the study of how our genetic makeup influences our response to medications. It looks at variations in our DNA that can affect drug metabolism, efficacy, and the risk of adverse effects. One common type of genetic variation is called a single nucleotide polymorphism, or SNP, pronounced SNP. These are small changes in our DNA sequence that can significantly impact how we process medications. For instance, some people may have SNPs that make them poor metabolizers of a drug, leading to higher drug levels in the body and an increased risk of side effects. SNPs are tiny variations in our DNA that can affect how we metabolize drugs. Some SNPs might make a drug less effective, while others could increase the risk of side effects. Understanding these variations helps doctors choose the right medication and dosage for you. So, why does all this matter? Personalized medicine can significantly improve health outcomes. For instance, in cancer treatment, certain drugs are now approved based on the genetic makeup of tumors rather than their location in the body. This means more effective treatments with fewer side effects. Studies show that using genetic information can double the survival rate for some cancers and reduce hospitalizations for heart patients by 30%. That's a game changer. So, how do we use this information? When prescribing a medication, healthcare providers can consider both the pharmacological classification of the drug and the patient's genetic profile. This means they can tailor treatments to maximize effectiveness while minimizing risks. Let's take an example. Consider a patient who needs treatment for high cholesterol. Statins are a common class of drugs used for this purpose. However, genetic variations in enzymes that metabolize statins can affect how well the patient responds to the treatment. By analyzing the patient's genetic profile, a doctor can determine the best statin and the right dosage for that individual. This personalized approach not only improves therapeutic outcomes but also helps avoid the trial-and-error method often used in prescribing medications. Imagine a world where each patient receives the most effective treatment from the start, reducing the risk of side effects and improving their quality of life. That's the promise of pharmacogenetics. So, determining therapeutic applications for individual drugs involves understanding their pharmacological classification, analyzing the pharmacogenetics of the drug, and considering the genetic variability of the patient. By integrating these elements, we can create a more personalized and effective healthcare experience. To wrap it up, personalized medicine is revolutionizing healthcare by focusing on the individual rather than a one-size-fits-all approach. It's about maximizing drug efficacy, minimizing side effects, and ultimately improving the quality of life for patients. If you found this video helpful, don't forget to like, share, and subscribe for more insights into pharmacology and personalized medicine. Leave your questions in the comments below, and we'll see you next time.
Pharmapal.